Hello, I'm Dr. Michelle Jorgensen at Total Care Dental and Wellness, and today I want to talk to you a little bit about children's tooth care. So there really are not a lot of secrets about this. The main thing is you need to keep the teeth clean and you need to feed the body well. That's the basis of it. So as soon as the child has the first teeth in their mouth, what I like you to do is put just a warm washcloth on your finger, and you're going to use that finger to clean the teeth. Now, is it essential? Are they going to get a cavity? Sometimes yes. They can get a cavity even in those early times, but the main thing you're doing is you're introducing this idea to the baby that it's okay for you to put your fingers in their mouth because you're going to be doing it for the next 8 years. So that's something you want to show them, that this is what mom and dad do. We help clean your teeth. Can you get cavities in those brand new baby teeth? Absolutely. And that's called baby bottle mouth, is maybe what you've heard it called before. What it means is if the baby is given, and it could be multiple things. We used to always think it was milk, but it could be milk. I've heard of people giving Jello water, soda, all sorts of things in that bottle. If that material sits on the teeth, what happens is the bacteria eat whatever's there, and the bacteria then create acid, and it dissolves the teeth away, and it literally rots the teeth away. And sometimes this can happen within just a few short weeks or months even. The baby's teeth look fine one day, a month later they're already have a significant tooth decay going on. Now these baby teeth are very thin, so once a cavity starts, it moves quickly. This is not something to mess around with. If you see a baby that has a dark spot on the tooth somewhere, a brown spot, something that doesn't look right, get him to a dentist immediately. And pediatric dentist, one that's really familiar with looking for these things, because oftentimes that can be stopped right there, and you can discuss what you're doing as far as feeding goes. And I'm never about shaming you or making you feel guilty or anything else. This is just education. Sometimes we just don't know. So that dentist can help you know what you need to know to be able to keep that baby's teeth healthy. Now, once we're beyond the baby tooth stage, what do you need to do? You need to keep them clean. So my rule is that they are not effectively cleaning their teeth on their own until they can use a fork and knife efficiently. So think about that. That's like an 8-year-old, right? So sometimes by age 3 or 4, they're throwing a fit. They don't want mom and dad brushing their teeth anymore. My rule is if they want to turn, that's fine, once a day. So mom and dad always get to brush either morning or night, and the child can brush the opposite time if they need to. But my preference is mom or dad brush twice a day for them, because you're just going to get in there and going to do a much better job than your child. So make sure you're cleaning them. Now, if you have 2 teeth that are touching each other tightly, and sometimes kids do, then you need to make sure you're flossing in between there. There's all kinds of cool floss holders and things that kids like. They can even floss themselves, get it up in there, make sure you're flossing in between, because sometimes that's where cavities will hide in a child. So those are the main things as far as cleaning goes. Now, feeding the teeth is really important as well. Do you need to feed them fluoride? No, not necessarily, because fluoride, well, I don't believe in fluoride systemically ever, meaning taking it as a pill or taking it in water. I don't think you need to do that, as long as you are providing that little body with all the vitamins and minerals it needs to create strong teeth on its own. So that's the key. You can give your child cavity-resistant teeth by what you feed them. They need to be eating a lot of fat-soluble vitamins. Those are A, D, E, and K, and you can learn more about those online, but you need to make sure that you're making those teeth cavity-resistant by the foods that you're feeding that child, and that's huge. Sticky foods, sugary foods, sometimes sugar's hiding in things you don't realize, like cold cereal. It doesn't sound sugary, but the entire thing is in essence sugar, and it's digested as sugar right there on those teeth. So make sure that you're feeding your child things that are building their body, not contributing to tooth decay. The third thing I wanted to talk about was what's called interceptive orthodontics. What this means is we can intercept your child needing braces, sometimes early on. Not only does it intercept the need for braces, but it influences the growth and development in a way that oftentimes helps the child with their behavior, helps the child with breathing, helps the child with growth, helps the child with focus, with a lot of things. So there are appliances, one in particular called the MyoBrace, that can be used as young as 2 and 3 years old, that direct the growth of the jaw and the teeth so that the teeth come in straight, so that the airway is open, so they're getting enough air so they can focus and behave well in school, so that you don't need braces in the future. So this is something I encourage every parent to look into if their children's teeth look like they're not coming in with enough space, or they're coming in crooked. So hopefully those are some helps for you on how to take care of your kids' teeth. Thank you.